good to have a press conference at 7:30 in the morning when we haven't stayed up all night working on logistics for another case. And this is somewhat of a happy press conference for us, because today we are able to announce that of the original 48 contacts, 43 of those contacts have effectively rolled off and are Ebola-free as of midnight last night. There is one person who will roll off a little later this morning due to the time that they rode in an ambulance before it was taken out of service that Mr. Duncan rode in. There are 4 more people who were healthcare workers who saw Mr. Duncan on the 28th and continued to have contact with him after that time for some time. They'll be rolling off a little later. But all of those 48 are well into, 43 are off, and the one will be later today, and the other 4 will be in the coming days. So that is very good news. I want to take you back to that aspect of this fight against Ebola. Mr. Duncan began exhibiting symptoms either on the 23rd or the 24th. He was not placed in isolation until the 28th. The disease detectives, and there are 9 of those with Dallas County Health and Human Services, had to go out into the community immediately, even before the EPA teams from the federal government got here, and began doing a contact tracing and find the right people. Because had they missed someone, and we had a person who wasn't monitored and had been out in the community for 4 or 5 days with another Ebola case, then this would have multiplied. The World Health Organization tells us that for each Ebola case that is treated, 2 more come up, and that's what we're seeing right now here, even with American medicine. So the worry for all of us was that due to the fact that Mr. Duncan was out in the community for a time, that we would have a lot of disease contacts. Well, they were able to find those 48. I will tell you, I can remember Mayor Rawlings and I meeting an epidemiologist in a parking lot named Emily, one of our Dallas County epidemiologists, and along with some first responders searching for a person who lacks a home, who's now, or up until yesterday when he rolled off the list, was a guest of the county and the city, and for that matter, Presbyterian Hospital. They really did just some tremendous work, and they're doing some tremendous tracing work. I wanted to bring them up here to kind of praise them, because they are all young people. They're all pretty new from out of school, both at the county and the state and the feds, and they've worked just so incredibly hard. They've declined to be on camera. They're afraid it might interfere with their disease tracing work. But I've got a statement from one of them about the Tro family, and let me read that to you real quick. When our contact tracing began, working with Mr. Duncan's family and friends, they were understandably going through a very difficult time, full of fear and uncertainty. However, throughout this monitoring period, this family has been nothing but cooperative and gracious. We were able to support them through difficult times and celebrate with them on the day they had been waiting for. It was a pleasure to not only to be let into these families' homes, but also to be let into their lives. We understand this has been a very trying time for the families, but we wish them all the best moving forward. We've got our state and federal partners here with us this morning as well, and I'm going to introduce all of them. But before I do, I want to talk about the 5 children that will be returning to school, and I want to ask for the community's help. I'm sure Mike Miles will speak to this as well. These people, part of our community, are integrating back into our community. And I talked to Louise last night on the phone, and her feeling for this morning was one of fear. Fear of how she and the young men would be accepted, of how they would be treated, of whether they would be seen as disease carriers or oddities. There's zero risk that any of those people who have been marked off the list have Ebola. They were in contact with a person who had Ebola, and the time period for them to get Ebola has lapsed. It is over. So they do not have Ebola. They are people who've been through an incredible ordeal, and they are people who need our compassion, our respect, and our love. Treat them the way you would want your own family treated if you were in their place and they were in yours. It's understandable that there's a lot of people that are afraid. Fear is normal. You know, I see life through the eyes of a child as a parent, and I know what it's like, and I remember for myself what it's like that first time you step onto the high dive. You know, young people were not designed to jump off of boards into pools, and it's scary. And sometimes we go up there and we have to come back down. And sometimes we have to get daddy or mommy to go up there with us. But if we look at what is going on and we see that the lifeguards and our parents and everyone involved in the swimming pool is not lying to us, and that the high dive is not going to kill us, then the children jump off the high dive. And that's a lot of what we have to do in this situation. We have to believe in science, that what separates us from other mammals, all mammals have a fear reaction where the herd runs from things. I grew up around, in the country around animals. I've seen a herd of horses spooked by a snake and running, and that's probably a really good idea if you're a horse. I've seen a herd of horses spooked by a beer can shining in the sun, and beer cans don't really attack horses often, so there's not much reason for running from a beer can. This is more of a beer can at this point than a snake for anyone who was not exposed to the bodily fluids of Eric Duncan. So please treat these people with dignity and respect as they come back in. I'll be honest, as a parent, I'm extremely concerned for Louise's middle school son. Middle schoolers are some of the most ferocious and scary animals on the planet. And to be dropped into a pool of middle schoolers after all that he's been through, I need your help, parents. I need your help to treat that young man with the kind of love you'd want your own child treated with. I want to introduce the people that are here with me who've been part of a successful and integrated team. Of course, Mayor Mike Rawlings, who will speak next, Superintendent Mike Miles, who will also have some remarks. We've got Sherry Christian, who's the Executive Director of Student Services at DISD. And we've got George Mason. I think everybody knows George Mason by now. George is Louise's pastor, and he is one of the people that does not talk about his faith. He lives his faith, and he's living it now in service to Louise, as is the congregation at Wilshire Baptist Church. Dr. James Zeretic, who's with the Texas Department of State Health Services, where Dr. Lakey is the commissioner. Kevin Haynes, who's the federal coordinating official, who's here. I don't think y'all met before, so I'll make sure you get a chance to say hello to him. And of course, Zach Thompson, our Dallas County Health and Human Services Director. So it's a good day for 43 people. It'll be a good day a little later for a 44th, and it's getting to the end of the period for the other 4. But there's still 75 people at Presby, 25 people, mostly moms, who spent the night there last night going through the toughest time in their lives without the benefit of a hug from their children because they are afraid they'll become symptomatic around their own children. Those healthcare heroes are tremendous people going through tremendous ordeal, and they need our help and support. We've got 2 young women who dedicated their careers to helping other people, who knew there was a risk of getting sick when you're around sick people, and who got sick, and who are fighting a brave fight at 2 healthcare facilities against Ebola. They all need our support as well. This, I believe, is a defining moment for Dallas. The world is watching Dallas, and Dallas must determine if Dallas will deal with this with grace and compassion, and have the thing that separates us from all other animals is the ability to reason and our faith. We need to be able to have reason, and we need to have faith in the facts and the science. If we can do that, then we can be a beacon for how others should deal with the sort of adversity when the next Ebola case happens here in America. So I urge you to get that message out. And here's my friend Mike Rawlings.
Thank you. Thank you, Judge. It's been an honor to work with you, and Zach, it's thank you for the county's professionalism at the city. There's no question today is a milestone day. It's a hurdle that we need to get over, but there are other hurdles to also jump. I am particularly lifted up by today because it's starting to show us the science that we talked about at the very beginning is working. When people monitor themselves, when we monitor them, we check their temperature twice a day, we can make sure that if they are sick, that we get them to the hospital quickly, and then when they're not, they can come out and be healthy. We're going to kind of walk you through just briefly where we are in this process, and then I have a couple other things to say. And if you can put this up. If everybody can be tolerant of 1 or 2 numbers either way, okay? This was numbers that were coming down this morning, final where we are, but I just wanted to give everybody a sense of where we are. So the Duncan initial contacts have been coming out this weekend and will be over the next couple of days. This is the days of incubation, a CDC mathematical model, not a predictive model, and the frequency of different cases that we've seen around the world. We are, for folks that had initial and ongoing healthcare workers that had contact with Duncan, there are about 55, 54 of those out there. And then we're going to be tracking the nurses, healthcare workers, and we're very early on in that process. As you know, she left on Thursday/Friday, and we stopped to contact the Presbyterian there. So you see the basic groups. Now, there are different numbers that have kind of mingled and bunched the numbers in a little bit different way, but that gives you kind of a sense. So every day that we go by here is better. We're going to be getting into some critical time with Ms. Van and Ms. Vincent's healthcare workers, and that's why we say we want to take this day by day in everything we do. So that gives you a little bit. Thank you. Thank you. The next thing I wanted to talk about was you guys. I want to say thank you. Too many people and too often criticize the media. I want to say a particular thank you to the Dallas media. You've been unbelievably responsible in getting the facts out, whether good or bad, but I think in the right level. And around the nation, thank you for the producers. Thank you to the editors. Seriously, you've been part of this, and I just, as we continue to need to have that sense of responsibility. Also, as we talked about, those are named, Vincent are names, but these are human beings. These are nurses. Judge Jenkins has said this before, but I think it's extremely important that we realize that these are heroes. In the city of Dallas, I'd love this week to be Hug a Nurse Week, okay? We just need to go out there and say thank you, healthcare workers, for what you do day in and day out. And if we can't hug Nina and Amber, we can say thank you to you. And so let's lift these folks up. And lastly, look, there have been some missteps, and we've talked about those things. Dallas is strong, and the Presbyterian Hospital is strong. It has been a good hospital in this community, and it is undergoing some tough times. We are letting it breathe, and it's got an important role, as Judge Jenkins laid out this weekend, in coordination with the rest of the nation. But Presbyterian Hospital is going to come back strong as well. Lastly, it is my honor to recognize a couple of people. One group that is not here, and that is Bishop Kevin Farrell and his aide, Bill Keffler. The reason Bishop Farrell is so important in this is he is the individual in the diocese, the Catholic diocese, is the individual that really came forth to house Louise and her family. We found a gated community that was a Catholic retreat area in Oak Cliff, and that's where Louise is at this time. This would not have happened. It was safe, it was private, it was safe for the rest of the neighborhood, and it really provided these last 2.5 weeks as a really respite for that family. I thank them out of the bottom of my heart for this. And if you're a member of a parish in the Catholic diocese, you guys did good and really helped our community at that moment of time. And that's what has happened with the faith-based community. They've really come forth. I'm going to introduce Nina's pastor, George Mason, who will talk a little bit about his conversations and plans for what the church is doing to get her family back on her feet. They will be working with a philanthropist that has come forward to fund a great deal of the expenses, but his church is as well. So we'll do that, and then we'll have Mr. Miles talk about what's happening in the school. George.
Thank you so much, Mike. My gratitude also to Mayor Mike Rawlings and County Judge Clay Jenkins. They have been remarkable public servants during this time. I want to reiterate also, as the mayor had said, that my experience and that of our church with all of you in the media has been quite exceptional. I appreciate very much your kindness, your consideration of all of us. This has been a really unusual circumstance, as you can imagine. We have not found ourselves in such a position before like this, and although Judge Jenkins' words about my living the faith, not talking about it, was something I think you can understand, I feel like I've talked about my faith an awful lot the past few weeks, and so I'm glad to be able to do that, but mostly to do it on behalf of our church and also Louise Troe. Louise Troe and these 3 boys who have been with her in quarantine are remarkable people. This has been a situation that's hard to even conceive if you haven't lived it. It is an isolating experience, filled with fear and anxiety about a very scary disease, and they have been able to manage this with extraordinary grace, along with the kindness of people who have written notes, who have cared for them with the health department and the CDC, government officials and the like. But people all over the country have written notes to them, have called, asked us to convey their sympathies on their behalf and to cheer them on. So today is a jubilant day for them. They are really looking forward to getting out and resuming their lives. Now, the mayor has thanked the Catholic Church, and suddenly you now know, I guess, or you will soon, exactly where they are. Okay, so one more request. They really want privacy still. It would be a tremendous gesture on your part to allow them to re-enter the community with, on their own terms and with some grace. Louise has asked specifically that she not do any interviews at this time. I know that you'll want to have those conversations, but she would really like to tell her story in her own way, in her own time, and there is a plan for her to do that. So I'd like to ask you to respect that, please, and to give them the grace of being able to re-enter in the way that they choose to do so. Finally, I want to say something that the judge pointed out as well. And that is, yes, there is some fear and foreboding in the community about this. I want to say that I think there's been tremendous support as well. We all have a choice in this. There is some fraying at the fabric of our community because of this. And everyone in Dallas has a choice as to whether we're going to pull on those frayed threads or we're going to begin to knit them back together. And we will decide by our behavior whether we're going to move toward these people in love and welcome and embrace them, or whether we're going to fracture even more, whether we're going to pull apart even more and make it difficult for them. I believe Dallas has risen to the occasion in this case. I believe we understand that this now is very much about who we are, not who these other people are. And so this is a test for us. We've been passing these tests for several weeks. I believe we'll pass this one too, and I urge you all to act in such a manner. Thank you very much.
Well, thank you. I just first want to say we are happy to have our kids back in our schools. 5 students will rejoin their schools on Tuesday. And we've been doing a lot of work. I want to reiterate what the others have said this morning. For all of us to be sensitive to our students. They've been through an ordeal, and I won't say much more. You've heard it already. But I think the schools will be well prepared. I want to reiterate also that our students are now cleared. And what that means is they don't have the virus. They can't give the virus. They're not contagious. They can't give it to anybody. And neither will they ever be contract Ebola, them or the other students or parents, if they don't come in contact with somebody who has the virus and is symptomatic. So our kids are clear. They're safe. They're going to rejoin our community on Tuesday. We've done a lot of preparation work for both the staff and the parents at the 5 schools. And I also want to take a moment to say we also need to thank our teachers and staff who have risen to the occasion. 3 weeks ago, the teachers and staff at the 5 schools just did yeoman's work by making sure the facts got out, making sure there wasn't a panic, and our attendance rate within 3 school days was back to normal. And that's good work from teachers and staff members. And I'm sure that on Tuesday they will treat our 5 kids with a lot of respect and dignity. We've worked with our counselors to make sure that the student body also understands that this has been a trying situation for 5 students who've lost a loved one and have been through a unique, harrowing experience. And so there's been a lot of preparation for that. We're also going to continue to keep our staff and community informed. And in that light, I want to say this morning that there may be 3 other students who will join our Dallas ISD community. 3 students who were at Wallace Elementary School in the Richardson School District. We were told over the weekend, we confirmed it over the weekend, have withdrawn from Wallace Elementary School in the Richardson School District. And their intention is to enroll in Geelstone Elementary School on Tuesday. And so we are going to be preparing the Geelstone community and staff and giving them information. Now, we've provided information to all of our schools and staff members and community over the last 3 weeks. But we're doing even additional work at those schools, those communities. And so we will actually have 8 students who've all been at home for the last 21 days join us on Tuesday. And we are welcoming them. We are glad that they're back in school. That's where kids belong. And we want to integrate them as smoothly as possible. And we will answer questions at the end.
Thank you. That's it.
As far as the people that have prepared remarks, we'll answer a few questions, but It's a little bit after 8. We've talked to you for 30 minutes. I bet you Mike Rollins and I haven't had a chance to talk to our wives that long in 3 weeks. So what do you got?
I do have a quick question. The mayor referred to missteps. I don't think anyone shied away from that, but I do have a question for you, Judge. The family of Amber Benson last night released a statement which recounted in some detail that before she flew back to Dallas, she made repeated phone calls to the county. She knew about the diagnosis of the other nurse, and she asked several times about should I travel, and was reassured and was told to come back. Now, my question is really this. Amber Benson took a lot of heat last week, a lot of criticism. I'm just wondering, does anyone owe her an apology? Because she seems to have done her job immensely.
Well, Amber Vinson did nothing wrong. And to the extent that it would help her family in healing on behalf of the joint team, one fight, and the decision makers that made that decision, I apologize for us to Amber Vinson and her family, because as I have repeatedly said, from the moment I found out that she got on that flight, that was a mistake. And that caused her problems. It caused panic in our community. It caused people to miss school. It caused a lot of overreaction. It was a mistake, and we apologize.
As far as communication during this crisis, you all have obviously done a very good job and been very proactive, been out there pretty much every day. But we've heard very little, relatively speaking, from the hospital, except for some written statements here and there. Certainly they haven't been out there talking. Do you think, and I know that you've been at the hospital since Mr. Duncan's death, pretty much around the clock, but there did seem to be that coordination between all the groups of constituencies early on. I'm just wondering, did the people that should be out there communicating not do the job that they should have done, at the beginning, and did that contribute to the fear and anxiety that's out there, and in some cases, unwarranted fear and anxiety?
There is a thin line between science and policy. And one of the things that happened with the airplane flight is that the policy leaders, including myself, were not aware of the decision to allow a person with a fever who had an Ebola contact to fly on an airplane. That is a mistake in our chain of command, not to push that up to the decision makers, and we've discussed that. I don't want to do an after-action report about that. The people involved understand, have been informed of the situation and how we can improve it. So one of the ways we improved it is that day, the day of the flight, I went out and set up an incident command at Presbyterian. We still have our emergency operations here. I put 2 cards on 2 doors. One said Rawlings, one said Jenkins. Called the president of the Presbyterian and told him that we would be coming there to assert incident command over the hospital there, so that we could have good communication with all of our peer groups and our EPI teams, our Dallas County, our federal partners, our state partners, so that all the information would get pushed up to the decision makers, and decisions that touched on policy or public concern would be made at the right level. And so I think we've improved dramatically that, and it's no one's fault underneath the principles. It's a situation where when this started and I was asked to take incident command, Mayor Rawlings, myself, Mike Miles and others were at our Dallas County EOC, where all the computer and all the apparatus is for an incident command, and the CDC and Presbyterian were out there at the hospital along with our Dallas County Health and Human Services EPI-A team. As the fight moved to Presbyterian, when Nina became ill, it became increasingly apparent that the decision makers need to also be at Presbyterian. The decision on the flight was actually made by people out of state, but nonetheless, It helps for all the people in the state that are decision makers to be in the same building. We're doing that now. This is not a perfect response. There are no perfect responses. But as you can see from the success we've had today with 43 of the 48 people, it's been a good working relationship, state, federal, local, one team, one fight. And there's not a division between us. When we make mistakes, we'll tell you.
I'm going
Yeah.
to just add one thing to that, if you don't mind.
Sure.
Because the subject specifically was on Presbyterian. I think this is a learning moment for us as a community and institutions, because they tried to be responsive, but also having the days out there to make sure all the facts are correct was probably what they wish they had back, you know, to make sure they were actually slower at times. And once they went through those first couple of days, making sure they had all the information and working through Judge Jenkins and myself was really their strategy, and I think a correct one.
Can you please update us an update as far as what you've heard, Nina and Amber, what's the condition?
And her boyfriend, Nina Pam's boyfriend.
Nina Pham's all of those things are going to be, I know the answer to those, but all those are their personal health information. They're getting the help that they need. I think Nina, well, I'm just not positive what each family will let be released. I can tell you that the two young healthcare heroes were able to communicate via FaceTime with family and friends. It's a very difficult time for them. And you know, our hearts and prayers go out with them. I guess I can tell you this much more about Nina. The flight was very tiring, and that's more than anything, that's where you saw the good go to fair. She's just, you know, exhausted from all of that. But this is a serious disease. They need our thoughts and prayers, our good energy going their way. They're brave healthcare heroes. Ms. Vincent's family has asked that her condition be guarded and not disclosed. We want to honor that. My hope and my belief at this point is that both of these women are going to walk out of those hospitals.
Judge, can you clarify one thing? The statement last night that was put out, she mentioned that she asked for arrangements to be made for her to come home. Can you clarify, you know, what the arrangements were that she was requesting, whether that was turned down? And then also just now when you said that the decision to let her fly, I couldn't hear whether you said it was made at the state or out of state.
I believe the decision was made in Atlanta, but it's one team, one fight. And to the extent it provides any closure to people, I'm happy to talk to them about that. Those are decisions that clearly we need to get all the principals involved in, because it had a serious, you know, repercussion on our community here. All right, as far as your statement, I don't know if Mike can address it, because I have not seen the statement. You know, worked till about 10:30. The team was still at the hospital working, and by the time you watch a great Cowboys win on DVR, skipping all the commercials and go to sleep and wake up and talk to you, I just have missed that. Well, again, I haven't seen that. You know, it's a difficult balance that you have when you're in my position. I'll just tell you, it's one team, one fight, and I am very proud of our federal and our state and our local partners in the work that they're doing. I've said that's a mistake. It was clear I was not happy about it. It need not be clear when I'm unhappy outside of the team, because I'm trying to lead people in a unified way to get this done. And I think we talked enough today about something that happened in the past. I don't want to point fingers in the past or talk about what was done in the past. I don't ever want to see it happen again.
Can you clarify though, she did seem to make it sound like she had spoken to someone at the county level, health
Yes. My understanding is that she spoke to her county contact, who passed that up the unified chain, and that was the person that she personally interfaced with, but not the decision maker. And I'm not sure which one that is. Probably be her epi, if I had to guess.
So y'all are breathing a little easier this morning, but
Yeah.
still not on the list.
We're breathing a lot easier. And speaking of that, of those epis, or epidemiologists, there's some from the county, some from the CDC, some from the state, and for that matter, some from our surrounding brothers and sister, our surrounding sister counties, men and women from the surrounding counties that are coming in to help us, and we appreciate that. This allows them to not have to go take the temperature and do health checks twice a day on 43 people. And I asked one of them, Lauren, yesterday, what that would mean, and she said that means I'll be able to start getting 6 hours of sleep, at night, and that's good. I want our team at this point to get about 6 hours of sleep at night, if at all possible, except for when we have emergencies, because people are beginning to really wear down, and we don't want to make mistakes because we're exhausted.
Judge Jenkins, how many people are still being monitored now, and is there an end date for when people are
I got that.
Mike's got it with his chart.
All right, the magic date, November 7. That was figured out last night, so we are breathing a little easier, but we're still holding our breath a fair amount till November 7 comes. And it just showed you that with 27, I believe the number is, we're at the very beginning of that. Not that we think there's anything wrong there, okay? But that we just know that that was the last contact, and that's how we're proceeding to November 7th.
So, Mayor, how many total are being monitored now?
100 and, no, there was a,
It's 145 yesterday.
but minus the 43.
102?
Yeah, something like that.
Let me say this one thing about that before we go.
Please.
Yeah. So Mayor Rawlings and I, neither one went to college on an academic scholarship, all right? And
Or a math scholarship.
yeah, or a math scholarship. And I asked my advisor which one of these degrees had the least math in it. So understand, we're trying to get you these numbers, and in all seriousness, these numbers will move some, because these disease detectives go out and do their work, and someone says, oh, well, I forgot, I went through the room and I picked up Nina's blood sample on this day. Then that might move it some, or you might find someone who slept on the same couch with someone when they may have been symptomatic, so they get added to the list. That's why you see these numbers move around some. Every disease contact on this list is on a monitor list. We're monitoring them. There's not anyone that we're looking for.
The 4 healthcare workers that haven't rolled off yet, when did you say you expect them to roll off?
It depends on their last day of seeing Mr. Duncan.
They're on day 12 right now of 21.
Well, not the 4.
I'm sorry, I thought, yes. Oh, I'm sorry, not at the 48. I
It's a
misheard that. My
different
bad.
time for each of them. There might be some, I've got to go look at our chart that their names are on to see. The latest it could be would be the 29th, but I believe all 4 of those are like in the next 2 or 3
Hey,
days.
I just got message. The answer to your question is 120 are currently being monitored.
Okay.
120.
The next couple
And once
days,
again,
that
that,
are still,
Yeah.
Yeah.
Yeah, please.
That's just in there.
well,
In this area.
in this area, okay.
now that the county can run Ebola tests, can you tell us how many of those tests you have?
Zach can tell you about that, because we ran our first Ebola test yesterday, and that's a big deal for Dallas County. There are only 12 states in the country that can run a PCR Ebola test. And to my knowledge, there's only one county in the country. There may be more, but as far as I know, there's one county in the country that can run it, and it's Dallas County, and Zach can tell you about that test.
Well, we're very excited, thanks, Judge, and the collaboration. Dallas County Health and Human Service, I want to thank our laboratory staff, headed up by Dr. Bannister, his ability to do the PCR testing. To date, we've done 2 tests in our Dallas County Health and Human Services lab. That gives us a faster turnaround as opposed to driving the samples to the State Health Department, which we really want to thank them for doing the testing. But the testing done at our building allows our staff to get a faster turnaround, and that we don't have to drive the specimens to Austin, and therefore we can get a quick response back to the judge and mayor on the results of the samples.
Did you just say it's 120 and not 102? Is the actual number of people still being monitored?
That is correct. That's correct. 1220. So that's it for today. You know, I think the takeaway is, let's support our hometown healthcare heroes. Let's support these 8 young people who are going back to school tomorrow. Let's support them in any and every way possible. Let's support Louise and all the other people that are coming off this. That, you know, they not only need your prayers, it's not a bad idea to drop them a note. You know, any way that the people of Dallas County can show support for these people, or the people of North Texas or America can show support for these people, is a helpful thing. It's a defining moment for Dallas, and it's a moment that I believe we won't be found wanting in, either in our response to stopping Ebola or the outpouring of compassion that North Texas is capable of. So thank you very much.
Thank you.